actually incorporates into the muscle almost like Wagyu steak. You know, when Wagyu is really marble and it's, you know, that's what makes it super good.
Lo está comparando con la carne Wagyu, básicamente.
Yeah. People say it's fake abs because it's not earned in the gym, for example, but it's earned with their paycheck, I say.
I know,
right?
I love it. I love that. I did it. So.
Yeah. It's
what they have done?
allegedly have done.
Allegedly. Yeah,
Okay.
sorry, because we can get a lot.
Allegedly.
Allegedly.
To me, it looks like she's had a rhinoplasty. That's the most striking thing. Very tastefully done.
Hola, yo soy Lale, estamos en un podcast sin anestesia
Y yo soy Laura.
y este es el capítulo que más me tiene nerviosa. Por un pequeño detalle que yo no hablo inglés.
Este episodio es muy especial porque tenemos a uno de nuestros doctores, el Dr. Keys. Ya se los vamos a presentar, pero básicamente Lale se siente un poco nerviosa, pero está bien porque vamos a practicar, we're gonna practice Spanish y vamos a practicar inglés. So, welcome, Dr. Keys.
Thank you so much. I'm super excited to be here. Thank you guys for taking the time to talk to me on this podcast.
Thank you. I want to start asking you about yourself. How do you start, becoming a surgeon? All the journey. Tell us about it.
Perfect. So I'm a board-certified plastic surgeon. I actually was born in Japan and immigrated to the States when I was about 5 years old. I grew up in Gainesville, Florida. I went to the University of Florida for undergrad, and then I went to University of Miami for medical school. I went to South Carolina for my general surgery training, and then did my plastic surgery fellowship at the University of Louisville.
So you have a lot of experience. Y por si no sabías, el doctor es original de Japón. ¿Sabías?
¿En serio?
Sí, yes.
Wow.
You speak Japanese?
Choto anashiteru. Yes.
Wow, I'm amazing. I love it because we're going to learn Japanese.
And the Spanish? What do you say in Spanish?
Yo hablo un poquito español.
That's amazing.
Wow. ¿Qué sabes decir? Quiero saber. Quiero que nos diga lo que sabe sus palabras en español. Like,
The word that you like.
Yeah, yo entiendo more, like más, right? A little bit. Yo aprendo con Duolingo. Yeah.
Everyone learns with Duolingo. We love Duolingo. It's amazing, especially from here, from Miami.
Yes.
Because everyone is like, it's very multicultural city.
Yes, absolutely.
And it's really helpful. But yeah, we're going to talk about trends on surgery, celebrity surgeries, because he loved talking about that in his page.
Yes.
So, I don't know.
I have a question.
Okay. She has a question.
Okay.
Amazing.
What are the new trends for plastic surgery?
Oh, that's a great question. And so there's a lot of new trends with plastic surgery. I think the trend has been going towards more surgery rather than doing fillers. I think what we've seen, especially in the celebrity culture, is a lot of celebrities were getting overfilled with fillers, and you can see like pillow face where their cheeks are super big. And so a lot of these celebrities have been getting their fillers dissolved, and actually getting surgical procedures to correct it, and either doing fat grafting, which is more natural, or even doing things like facelifts in order to remove the extra skin. And I think we've started to see a lot more natural looking results, and so I think that's going to be the trend. Also, I think with the advent of Ozempic, a lot of people have been losing a lot of weight. And so the trend is more natural looking results when it comes to BBLs, for example. Instead of overfilling the butt and making it look like an ant butt where it's kind of too big, people are going for more natural looking results because I think people are just skinnier overall. And so.
And what is your favorite new trend?
My favorite new trend, to be honest, I like to do the high definition lipo sculpting. And doing the fat grafting to the muscles themselves. I think that gives a really natural result when it comes to lipo etching, for example.
That's like fake abs or something?
Kind of, yeah. So people say it's fake abs because it's not earned in the gym, for example, but it's earned with their paycheck, I say.
I know,
right?
I love it. I love that. I did it. So.
Yeah. And so, you know, whatever, hard work is hard work, whether you do it in the gym or you do it at your job and you pay for surgery, right? And so the way I do it is with an ultrasound, and I'll actually inject fat into onto the muscle so that it pops the muscle out. And then you take away from the areas like the etching part. So then it kind of gives a three-dimensional aspect of the muscles, right? Before, people just used to just take away from the areas, which is fine. I mean, that looks good too. But I think if you enhance the muscles, especially in men, then that gives you the best result. And so that's a new trend that I'm happy to be a part of.
Y yo creo que Lale tenía una pregunta con respecto a eso, que es sobre la cirugía de los hombres.
Sí. What is the difference between lipo for women and lipo for men?
That's a great question. And so lipo for women, I think, really enhances the feminine aspects of the body. For example, right? Like, let's take the torso, for example. In a man, you really want like a V shape or kind of almost a straight looking torso. While with women, you really want the hourglass figure. And so whenever I do liposuction for women, I really focus on the flanks to get that as narrow as possible. I've never heard a woman complain of a tiny waist, right?
No,
like, I've
never.
never heard of a woman complain.
She also wants like a waist like Belinda. You know Belinda?
Yes.
Tú sueñas con Belinda, ¿verdad?
Sí, total.
Esa
Yo
es tu
quería
celebridad favorita.
tener la figura de Belinda, pero bueno, me explicaron que no era posible. Existen cosas que la cirugía plástica no puede lograr. Pero bueno.
But yeah, you were telling us about the shape between the woman and the man.
Yes.
And how is it different when you are like performing the actual surgery?
Absolutely. And so for women, I use a curved cannula. So that's a little different technique that I use. A lot of liposuction cannulas are really straight, right? So that they can go long in the body. But I use one that has a curve to it. So then I can go around the curvature of the body. So I can really get the fat that can be really hard to get with the straight cannula, especially since my ports are in the front here. I don't make extra incisions on the side or anything like that. I typically do liposuction with 3 incisions, 1 at the belly button, 2 below. And so I can get all around the body that way. And so using the curved cannula, I can really accentuate the feminine like curves of the waist much better than I think with just a straight cannula.
Mira, está súper interesante lo de la cánula.
Yo no sabía, pensé que todas las cánulas eran straight.
Yeah.
I thought every cannula were like straight.
Ahora
cannulas.
tengo una pregunta
Okay.
y Laura me va a ayudar
Oh
con
my
esta
God.
pregunta.
Yo soy mala traduciendo, pero okay, I'll do my
Cuando
best.
tú haces como la high definition, que es como colocar los cuadritos o las líneas abdominales, ¿cómo la haces? O sea, ¿dejas la grasa o vuelves a inyectar la grasa?
When you do high definition lipo, you leave like fat in the stomach, or
That's a great question. So what I do first, the answer is yes. You do leave a little bit of fat, but really more the superficial fat. You never want to take too much of the superficial fat because that's how you get the dimpling effect. And so I hate that appearance, and so I always leave a little layer of fat on top. But what I first do is I take away the negative spaces. So the negative spaces, this is a technique created by Alfredo Hoyos. He's the founder of high definition liposuction. And he says to take away from the negative spaces or the shadow parts of the abdomen. And so whenever you see my markings, you guys can pull up my markings. But in the red areas are where I take away fat and then really give you that definition. And so I do that on the sides of the muscles here, in the center, in the linea alba, and then some areas over the muscle, depending on how defined you want to be. Like for a man, I do really definition because they want that masculine look. But for a woman, typically not unless she's like an athlete or a weightlifter or something like that. So I typically focus on the sides and maybe a little bit here. I don't really do too much on the cross sections here because I think that makes you look more masculine. And so unless the woman is wanting to look like that, I typically leave her very feminine.
o sea, él básicamente hace como un sombreado de tu abdomen para resaltar el abdomen, pues la
Está
apariencia
cool.
natural, dar una apariencia natural.
Está cool porque ciertamente si deja demasiada grasa ya deja de ser estético y he visto muchísimos casos en donde eso pasa.
Y que no se ve como balanceado con el cuerpo de la paciente, ¿sabes?
Tengo una pregunta, no sé si lo dijo porque bueno, pero todas las pacientes pueden ser candidatas a una marcación abdominal.
Is every patient candidate for high definition liposuction?
I wouldn't say every patient, especially patients who are still on their weight loss journey. What I recommend too, this is a great segue, is that, especially for men, I don't recommend starting off with high definition of the abdomen because that doesn't look natural. Like if a guy goes to the gym, they don't really just focus on their abs and only their abs, right? If they don't have any upper body or any arm definition, then it looks kind of
But
obvious.
I've seen that, like a really like ripped fake ab and no muscles. And, like, arms.
Yeah. And that to me is like a clear giveaway,
Uh-huh.
right? And so what I've started to recommend my male patients is to really do fat grafting to the shoulders so that they have some broad shoulders, and then also do fat grafting to the pecs so that it really looks like they have upper body definition, because that's typically what most men start out with in the
Yeah.
gym. They do bench press and stuff like that and really build the upper body while building the abs, right? And so I do a procedure where I can do all three at the same time, where I fat graft the deltoids, fat graft the pecs, and then also do high definition liposuction of the abs in order to give you that like fresh out the gym, like, masculine look.
Does that have like any risk? Like do like fat in here or in the pecs?
So that's a great question. So every surgery has its risks, right? However, with the ultrasound, we can see where the blood supply to these areas are, and so it's infinitely safer with it. I always make sure to use an ultrasound to see where the blood vessels are. And the good thing about these areas are the blood vessels are not as big as the ones in the buttocks, for example, where you hear about the complications, fat embolism, or the fat goes into those vessels, and it can even result in deaths, unfortunately. However, whenever you use an ultrasound, the risk of that happening is super duper low. Like they've done anatomical studies or cadaver studies where they use an ultrasound and no fat goes below the muscle as long as you can see where the tip of the cannula is. So.
E implantes. ¿Existen los implantes para parecer que tienen los hombres cuadritos?
Is there any implant for like abs?
Or no?
There aren't like silicone implants, but I use fat.
Yeah.
And so what I use is an ultrasound. I find the muscle, and then I inject a little bit of fat, maybe like 30 cc's in each each ab muscle. And so then it actually incorporates into the muscle almost like Wagyu steak. When Wagyu is really marble and it's, that's what makes it super good. That's what happens when you inject fat into the muscle.
Lo está comparando con la carne guayú, básicamente, cuando inyecta grasa al músculo,
Yeah.
que es como más moldeable. But the implants does exist for abs.
I'm
Or
not
not.
aware of
That's
any.
crazy,
No,
like-
they have implants for like pecs and the calves
yeah.
and everything, but I don't know of any.
Is it safe for the calf to put implants in there?
Yeah, they're safe. They look like little strips of like meat almost, and you just make an incision and you just insert it under the muscle.
Wow.
Yo solo se me ocurre una pregunta súper random en este momento porque estoy con una persona que es japonesa y me está hablando de carne guayú. ¿En dónde me recomienda ir a comer a carne guayú en Miami?
Yes.
What's your favorite restaurant for guayú?
There's some good omakase places here in Miami.
Yeah,
they got some Michelin stars, and so I could share them with you guys. after.
Please do, because we love to eat.
Yes.
We love to go to restaurants.
Perdón, es que estaba con una persona japonesa hablando de carne guayú. Necesito sus recomendaciones de restaurante, por favor.
I know. I'm like getting like to know you more, and like you love doing like plastic surgery on men, right?
Yes.
Do you have like a lot of patients, like male patients?
Mm-hmm. Yeah, and what trends have shown over time is that men have been getting more and more plastic surgery over time. And the reason for that is it's not as stigmatized, or people don't, look down upon it as much, especially amongst the men community. It's still overall a female-dominated industry. It's about 90% women, 10% men. But again, that's still increasing over time.
Okay.
¿Puedo mostrar unas fotos para ver qué nos dice el doctor que se han hecho ciertas personas?
Yes, we're gonna show him like some pictures of celebrities, and he's gonna tell us what they have done.
Ok.
Allegedly had done.
Allegedly. Yeah,
Okay.
sorry, because we can get a lot.
The first one.
Allegedly.
Allegedly.
The first one.
Okay, wow. Who is this? Is that Ronaldo?
Yes.
Oh my goodness, he's a good one.
I love Ronaldo.
Yes. So this is a picture they showed me, which is fantastic. So Ronaldo, he is a good-looking man, but he, in my opinion, has work done. He definitely had his teeth worked on, probably veneers. And then as far as other like plastic surgery work, it looks like he had an upper blepharoplasty where you remove
Oh
the
yeah.
eyelid skin. Because you can see here is really hooded. And then here you can see some definition to these upper eyelids. It looks like he may have had some lip filler done, or at least a lip flip. He has a really gummy smile before, not as much in the after. Definitely some some fillers to the jawline, to the cheeks, to really enhance the bone structure. I do think that he also could have potentially had a jaw implant. You know, you can have implants. So it could either be done with filler or just an implant.
But it's probably an implant because he's like always running and doing exercise, and fillers like
Yes.
dissolve, right?
They can dissolve. Yeah, it depends on what you use. So there's some that are more permanent, like Radiesse or Bellatero. There's some more permanent fillers. But yeah, this definition and this longevity, I do agree. I think it probably is some type of implant. So yeah,
Next.
very nice work.
Oh, sorry.
Oh, pásamela ahora.
Next. Mrs. Bella
Oh,
Hadid.
wow.
My favorite.
Bella Hadid. Very nice. She is an attractive woman, obviously, a high-profile model. She looks a lot different than she did. This is more in her youth, and this is her now. So I think Bella Hadid is one of those celebrities who really popularized the fox eye lift, or a canthopexy or canthoplasty, where you kind of tighten the tendon here, and it can give you a more Asian appearance. I may have it more natural one just because I'm half Japanese, but she also looks like she's had a brow lift. You can see the corners of her brows are a lot elevated. This can be done with the endoscopic approach, where you just make incisions in the hairline. That's why you don't see any incisions on her face. She's also, in my opinion, had a rhinoplasty, a surgical rhinoplasty. You can just see the difference in the tip of the nose. You can see the difference in her aesthetic lines. And then cheek filler, most likely, buccal fat removal, and probably...
Oh, wow.
Yeah, you can see that she's got a lot of definition in her buccal fat area here too. And so, yeah, I think she's had very tasteful work, and that's why she's a A-list model.
Oh my God.
Yo tengo una
She's
pregunta antes, antes de pasar con la siguiente persona, y es si él recomienda la bichectomía, porque sí he escuchado que hay muchas opiniones con la bichectomía.
Do you recommend bichectomy, right?
Yes, or
Buccal-
bichectomy or buccal fat
Yeah.
removal, yes. So that's a great question. And so I think I recommend it in very select patients because it can age you. And so even though it looks nice and looks very model-esque when you have the buccal fat removed, it can also give you the appearance of you looking older, especially as you become older, because the fullness in the cheeks is actually a marker of youth. And so that's what really makes you look young. And so as you get older, the buccal fat naturally atrophies over time, and that's why, old people have very gaunt looking cheeks. However, there are people with really full buccal fat that could look a little bit better with very selective removal of the buccal fat. I never recommend people go overly aggressive and remove too much, because that can make you look really old.
Tú te lo querías hacer, ¿verdad?
Sí, sí, la verdad, por segunda vez. ¿Se puede? Pero quiero preguntarle al doctor, ¿se puede hacer una segunda bichectomía?
Can you get like two buccal fat removal? ¿Tú ya tuviste una?
Sí.
She already
You had
had
one. Oh, really? Okay.
Can
Yeah.
I do the second one?
You can, yeah, you can. And you just have to make sure that it's the buccal fat that you're really removing and going after. And then I would want to see how much they took away from the first time and kind of look at before and after photos.
Yeah. Oh my God. Anita.
Oh, wow. Okay, Anita. This is the photo that they show me. Very nice. And so she most obviously, in
This
my
is not
opinion.
allegedly. She
Yeah.
always say that she got everything done.
Oh, okay, yeah, perfect. So then, not
Not
allegedly,
allegedly.
then, right? So to me, it looks like she's had a rhinoplasty. That's the most striking thing. Very tastefully done. She had a really long nose before with a hanging columella. That's been fixed. It looks like she may have also had a canthoplasty or canthopexy as well, which also looks very natural and well done. Otherwise, it doesn't look like she's really had lip fillers or anything like that. She would maybe benefit from like a lip lift in the future. Otherwise, maybe some cheek fillers, some Botox, those kinds of things. But very tasteful work.
Yeah.
Talking about the bichectomy when you get
Oh,
old.
yes.
And she got like a really good job now, like Demi
Yes.
Moore.
Demi Moore, yes. So she actually went viral recently because she looks so good now. She really looks like a different person. This is the photo that they showed me. And so what happened before is, I think, is a combination of what we talked about before, where celebrities were getting overdone with filler. And so in the before, to me, it looks like she had really pronounced cheeks, along with other areas of her face where it looks like there's too much filler. And then that in combination with either a buccal fat removal or a very poorly done facelift can give you a result that looks like this. And so what I think she had done is she had her filler dissolved, and then she had a revision of her facelift in a more appropriate fashion, maybe a deep plane facelift. And that is why she looks so fantastic today.
She looks
And so
amazing.
it goes to show you that even with some botched, quote unquote botched plastic surgery or fillers, you can still get a good result if you see the right plastic surgeon.
Yeah, and she's
Really
like
good.
60, right?
Yes.
Something like that.
Yeah.
60, algo así tiene.
Wow.
¿En serio?
Mhm. She's
Wow.
really
Fantastic.
amazing. Yeah.
Bueno, vamos a preguntarle qué crees que se hizo Lindsay Lohan.
Oh yeah, Lindsay Lohan.
Lindsay Lohan, she is also an example of someone who I think went overboard with the fillers. She also was, allegedly into drug use and alcohol and partying back in the day. And so I think that really affected the appearance of her skin as well. And so I think she's become sober over the years. She got her filler dissolved. And then she just had really tasteful work to really restore, either with a facelift or fat grafting to the cheeks and so forth, as well as really good skincare, lasers, Botox, and those kinds of things to really give her that glow. So
Está súper interesante, la verdad.
I have a question actually. Can you re-inject fat into when you do the fat removal, the buccal fat removal?
So you can. It's just a little bit more challenging because the buccal fat is covered in a little fibrous capsules, and so it has a little bit more structure to it. And so you can use a more dense filler in order to simulate the buccal fat. However, I recommend above all to try to preserve the buccal fat if you can. And then if you ever needed to reverse it, you can look into either fat grafting, from other areas, or doing like a more dense filler under ultrasound guidance to inject in the proper areas to restore that volume.
Ahora tengo una pregunta completamente diferente porque yo soy así. Perdón. Pero se puede, o sea, las personas que se inyectaron grasa en los glúteos, ¿se pueden sacar grasa de los glúteos si en algún punto decidieron que se los ve muy grandes?
If you get a BBL, can you take off the fat that you inject there in the future?
Absolutely. Yep, you can. If it's done in the right area. So if the fat is injected into the muscle, unfortunately, you cannot remove that safely, at least, unless you do a surgical excision, which again would create a big scar. You can do some BBL revisions using liposuction. It's very difficult in a sense because you really have to, shape it correctly and kind of have that vision, especially because we have to put some tumescent in. So during surgery, it blows up, and you just kind of have to really keep an eye out on the volume takeaway from the left and the right side to make sure you have good symmetry. And so it can be done, but it should be done by an expert, not by, just any surgeon.
Está interesante.
¿Quieres hacer el mitos y realidades?
Estoy de acuerdo.
Sí.
Comienza tú.
Okay. We have a section like in Spanish is mitos y realidades, like myth and like facts, maybe.
Okay.
So we're gonna ask you something. You're gonna say like true or false. So the first question is, men doesn't get like BBLs.
False. I've definitely done BBLs on men. There are different techniques, especially if a man wants to look more masculine. And the difference is you preserve the hip dips. So for men, you really want to preserve the hip dips because that gives you an athletic appearance to your buttocks. And so you inject everywhere except the hip dips, and don't inject into the flanks because you don't want to round, hips in a guy. However, there are some men who want to look like more feminine, and so we talk about that before surgery, and then I can deliver those results if that's what they're looking for.
Okay.
La lipo te puede sacar toda la grasa que tienes en el cuerpo.
You can take off every inch of fat that you have with liposuction.
You can, but I don't recommend it. Highly do not recommend it because that's what will give you that dimpling look. And so the people who get too overly aggressive lipo will have that dimpling or marbling effect to their skin. And so I do not recommend it. So the answer is yes, you can, but don't recommend
Don't do it.
Yeah, don't do it. Don't do it. No.
Lipo is for weight loss.
That is false. That is a great question. Lipo is not for weight loss. I always recommend patients get to their goal weight first and then do the lipo because if you do lipo after or you're trying to use it for weight loss, unfortunately, especially if we transfer to different areas, you can gain weight or lose, fat in areas where you don't want to if you continue to lose weight. And so I recommend you reach your goal weight and then do the lipo so that we can give you the best result possible.
Tengo una última. Después de cualquier cirugía plástica tienes que estar de reposo absoluto.
After you get plastic surgery, you have to be like, ¿cómo se dice reposo absoluto? Like, what's the word? My God, I forgot. I knew it.
Buscarlo.
It was too good to be true that I haven't like had like lagunas mentales. Time off, like downtime.
Oh, downtime.
Yeah.
Yeah, after plastic surgery, you do need some downtime. I recommend it, especially depending on the procedure, obviously, right? And so depending on the longer you are in the OR, the more downtime you need is a good, ballpark way to say.
But you have to be completely still, like you cannot move or
No,
walk.
no. That's false. That is absolutely false. I actually recommend patients walk the next day after surgery or the day of even. And so I have a really good pain protocol that I use called the ERAS protocol. It's a evidence-based pain management protocol that gets patients on their feet a lot quicker. There's also different pain techniques we can do, like injecting using the ultrasound and finding the nerves, like, for example, to the abdomen. That really helps with pain control. And so the longer you are in bed, the more complications you can have, especially a DVT or a deep vein thrombosis or a blood clot that can potentially be fatal. And so I always have patients walk right after surgery.
Okay, I have a question for you, the last question. What is the 3 tips for the patients?
3 tips for the patients, just like in general?
Yeah.
In general.
Okay, in general, I recommend my patients, number 1, really supplement their diet with protein before and after surgery because protein is what we use to heal wounds. And so, whatever your protein count normally is, you have to increase it because your body's undergoing a massive injury in a sense, right? And so in order to heal, you need to really supplement your diet with protein. Protein also helps draw in fluid, and so after surgery, if you're having a high protein diet, it helps bring in all the inflammation and everything so that you can get rid of it naturally. And so I really recommend patients do protein. Number 2, I also recommend patients do their appropriate post-operative care, especially for body contouring procedures or like a lipo 360, BBL, tummy tuck, those kinds of things. Really focus on compression, getting the lymphatic massages. That's super important because we really want to get rid of all of that extra liquid and inflammation and swelling to really give you the best result possible. And then number 3, the thing that I recommend is that, as we just talked about, that patients walk as much as possible after surgery to reduce the risk of complications.
Well, thank you so much, Dr. Keys.
Thank you for coming and
You're
talking
welcome.
with us.
Thank you guys for taking the time to talk to me. I really appreciate it. It was really fun. So thank you guys.
Thank you. Perdonen mi inglés en este capítulo. La verdad es que nos encantó. Muchísimas
¿Lo harías
gracias
de
por
nuevo?
venir. Oh my God, qué miedo. No sé, díganmelo en los comentarios si quieren ver a Lale de nuevo hablando inglés. Pero de verdad que nos encantó la visita del Dr. Keys. Él es un doctor espectacular, nos dio tips bellísimos. Este podcast está patrocinado por...
Snatched Plastic Surgery.
Y las redes del Dr. Keys son de users.
Your social media.
Oh, yeah. You can find me on Instagram at Dr. Keys, DOCTORKEYES.
A mí me puedes conseguir como @lauribma en Instagram y Laura Montenegro A en TikTok.
Y a mí en todos lados como Lale Correa.
Y por supuesto, no te olvides de seguir al podcast, un podcast sin anestesia, dejarnos tus comentarios, suscribirse y nos vemos en la próxima. Bye.
Bye.
Bye.